Hello and good day to everyone who's joined in on this. That is our third session of Voice of the Village. Um, Good morning, good afternoon, and good evening, wherever you've joined in from. My name is Venatya, and I'm going to just kind of take you through what we have in store today. And we have a bunch of very interesting panelists um, from all different kinds of walks of life. So let's dive straight in. Before we get to the webinar, a couple of very important messages. If you could just go to the next slide. The webinar is going to actually take place in a couple of languages, that is English and Hindi. It is important that you click on the little icon, which is the globe icon at the bottom of your screen, to choose your channel. So if you want to listen to it in English, we would have the Hindi audio live translated by our interpreters. When you select your language, do keep in mind that there is a small option at the bottom which says mute original audio. That will basically ensure that the two tracks are not overlaid. By default, Zoom basically subdues one audio and adds another one on top. For a better hearing experience, what you should be doing is muting that original audio so you are hearing everything either in English or in Hindi. Just a quick repetition, interpretation, globe icon, choose your channel and mute the audio of the other channel by clicking on the mute original audio option. Let's dive straight in. Next slide, please. What is the Voice of the Village? The Voice of the Village is an interesting conversation. It's a series of conversations that we're sort of hosting as DLLABS, which is a collaboration between Dharma Life, the Wheeler Institute at the London Business School, and Siriti. And this is the third in the series, and a very special one because this one is co-hosted by Pathfinder, an organization that is working with Dharma Life for the Yuva program, which I will tell you about very shortly. So the Voice of the Village essentially brings together stakeholders from rural India, from urban India, global stakeholders to talk about issues that are pertinent and that are important issues that all of us want to work together to solve. Each one of the stakeholders who are on the Voice of the Village, the panelists, play a crucial role in coming together, in enabling collaboration to build these solutions, right? So the next question that you'd kind of have is, okay, great, but then what is DLLABS and why is DLLABS organizing this kind of an event? Next slide, please. So DLLABS, like I mentioned, is essentially a collaboration between three organizations, and we have a whole bunch of partners coming in as well. There's Dharma Life, an organization that is working to create rural entrepreneurs and alleviate poverty through inclusive progress in rural India. They have a network of over 16,000 entrepreneurs across 50,000 villages in 13 states. These are all members of the community, so it's progress by the community for the community in its truest sense. This gives rise to these local relationships, which allows us to actually interact with the people who we are designing for. With the cheap data and access to mobile phones, we have digital connectedness so that we're actually having conversations across cities, across states, across countries. And finally, we kind of put all of this together and have the other two stakeholders, which is the Wheeler Institute of London Business School, and Siriti, which is a design and communication agency, coming together to leverage these local relationships and the connectedness with real-time insights. But it's not all in theory. All of this is working towards a single goal of having impact, and not just basic impact, but impact at scale. So this is what brought these three organizations together to create DLLABS. And as an output of some of the work that we're doing, what we're doing is creating this Voice of the Village series, where we've done certain conversations, created certain solutions, had certain interviews on topics that are very important to create and drive that inclusive progress. We've had two already. This is the one that we're talking about, rural health, and specifically how rural health has been affected by the COVID-19 pandemic. While the more obvious health impacts of COVID itself are well documented, there are many other things that have taken a backseat. So today we will be exploring those things, including the very important topic of family planning. I'm not going to give too much away. I'll quickly set a couple of other ground rules. We have opened up questions and answers. You can ask your questions, because the way we've structured this is we're going to have a couple of sort of introductory remarks from each of the panelists. Professor Chandy from London Business School will kind of then come in and moderate a conversation between all of these panelists and stakeholders. So I'm not going to give too much more away. Fire away on those questions. Let's make sure that whatever points you have, whatever questions you want to ask, it could be to everyone, it could be to a specific panelist. Put that down into the chat. We're expecting this webinar to last about 60 to 70 minutes. So over to you guys. Professor Chandy, I think I'm going to sort of leave it at this point and let you kind of set context to the topic here and what we're really trying to do. Next slide, please.
Thank you, Vanatya. Thank you. It's a delight. It's a delight to welcome back many members of our community and to welcome folks from all over the world, many from rural India. As Vanatya said, that's one of the key objectives of the Voice of the Village platform and our activities is to bring together this global community, those from rural India, as well as those with a keen interest in issues that affect the world at large, but specifically those in rural communities, such as those in India. And of course, given the theme of our session today, which is around rural healthcare services, which is what you've signed up for, it's worth sort of stepping back a bit to provide some context first. At this point, most of you have both heard about the dilemma of balancing the challenges of health and ensuring we save lives and ensure that lives are healthy versus livelihoods, which is ensuring that people have food on the table at the very basic level, as well as can continue as much as possible with their livelihoods while remaining safe. And this is a dilemma that's playing out throughout the world. This is a dilemma that has been the focus of a great deal of attention, not only at the highest levels of policy and business and or organizations around the world, but also, and to the point for today, also in a very real and personal way at the grassroots, at the individual level. All of us are grappling with this in some way or the other. Now, when it comes to rural health specifically in India, we have an additional opportunity and challenge. Next slide, please. And that is that any solutions will have to be not only implemented at the community level, but also adapted, indeed created at the community level. It's one thing for experts to sit around tables and cook up ideas, and we've seen disastrous responses that came from experts sitting around conference tables and cooking up ideas and expecting that the world at large will follow it. It's another to have solutions that stick, the solutions that make a difference, especially in areas that are historically have been isolated and often deprived. And so how do you bring together, next slide, please. How do you bring together these perspectives, these insights, expertise, resources, and action that covers these three levels? The global reality, which many of us share often in ways that are different from each other, but many of us share. This is a global pandemic after all. To the rural context, and specifically in India, to the very micro level of individuals and communities taking actions. That's going to be the focus of the discussion. And we're definitely not going to sit around a virtual conference table with experts in the traditional sense of the word. We will actually sit around a Zoom conference table today with experts. That includes everybody, each of you on who are logged in right now, but also in a very special way, the true experts who are on the ground, the true experts who are creating actions and making change happen in the area of health on the ground. And to introduce our panelists, not only those on the ground, but also we're genuinely privileged to have those from government, from impressive organizations that have spent entire lifetimes studying and acting in this area. To introduce this, our panel, our wonderfully diverse and distinguished panel, let me hand things over to Gaurav Mehta, founder and CEO of Dharma Life.
Thank you, Rajesh. It's again a privilege to come back for the third time. So on this platform, and we are very honored to. Thiago, next slide, please. We're very honored to have to co-host this roundtable also with Pathfinder International, and privileged to introduce Daniel Sinnathamby. He's the country director of Pathfinder in India. We have been working with Pathfinder for the last couple of years as part of the Yuva program, and Pathfinder, obviously, everyone would know, is one of the foremost organizations in the health care space or family planning space specifically. And I would leave it to Daniel to introduce himself and also the context of this topic more widely. Daniel, over to you.
Thank you very much, Gaurav, and greetings to everyone from New Delhi and also to my esteemed panelists. I'm very, very excited and very looking forward to the discussions over the next 1 hour. So Vainatya and Dr. Professor Chandy have set the stage, and we have spoken about the communities and the impact of the pandemic on communities and what the implications are. So ever since the pandemic started and we went into the lockdowns, Dharma Life, Pathfinder, the London Business School, we have been very interested in the impact of the lockdown on communities. And simultaneously, there were very intense efforts made to prescribe behaviors to prevent infection, to interrupt transmission, to suppress transmission within the communities. And one of the interesting things that we found was that communities were not following these behaviors, partly because of the physical inability to do so, and partly because of misinformation. And simultaneously, the London Business School was talking to returning migrants, very, very interesting interviews, video interviews, migrants, and Dharma Life was gathering intelligence through its vast network of social entrepreneurs. So when we brought all this information together, there were some very interesting conclusions. First, COVID-19 was not a priority for the communities. Traditionally, also in rural India, health-seeking behavior is not a priority. Yeah, so health-seeking is very reactive, and so the COVID-19 pandemic was not a priority. So we actually try to understand from a human-centric point of view, how does this pandemic affect communities and the households and individual members in a day-to-day basis, and what's the implication of the impact and how are they responding to it. And so we had a series of community consultations. Pathfinder partnered with Photo Fiction Mill, which was basically a storytelling organization to talk to communities, talk to community leaders, key informants, and find out, what their perspective on this was. And for Pathfinder, it was very interesting to look at if prescribed behaviors are not working, how do we look at community capabilities? What solutions do communities prescribe? What solutions do they recommend? What are the capabilities that are available in communities to implement these solutions, and what support would they need in order to proceed or progress? So the three broad areas that we identified were, one was the collapse or erosion of livelihoods. So this was exacerbated by the return of migrants and not finding any local livelihood opportunities. So this led to significant adversities within households, a lot of distress activity, selling off of assets, mortgaging property, selling off of livestock. Then also there were very corrosive activities such as sexual exploitation, child marriage, distress activity. So the erosion of livelihoods was, I think, their main priority. The second interesting fact was that even though they were getting accurate information on COVID-19, there was no systematic discussion on how this information can help with contingencies. So there was a lot of uncertainty in the face of COVID-19, and it was a wait and see approach, and that was very concerning. And the third most important priority was the deprioritization of non-COVID-19 related services. So we saw that women could not go to clinics. There was a lot of confusion about the services that were being provided through clinics. There was an undoing of all the initiatives that had been going on, especially around TB, especially around cervical cancer, support for reproductive health, support for family planning. All of these had collapsed. And there was a huge concern that there'll be an increase in vulnerability, morbidity, and NCDs. But also there were very positive signs of collective action. For example, the Dharma, the labs, was something that was very positive. On the government side, there were very, very progressive initiatives that were being implemented, and one of them was the Niti Aayog Gates partnership around navigating the new normal. And I'm so glad that Urvashi is here, because she's been on the forefront of many of these initiatives and trying to identify best practices from the states. And then the private sector also, being involved in various technologies. So this is the kind of the reality, the global reality, being translated into the community. And so I think over the rest of this webinar, we will hear from various stakeholders on various facets, of how the COVID and the community, COVID and peri-urban rural communities. So we have started actually identifying solutions. I think Vainatia highlighted the fact that we already, so through the UR program, we already started integrating COVID-19 interventions. But I think this is a broader thing. In the future, I think there's going to be some mass interaction between the clinical community, the government, and the population. So either for antibodies, vaccination, and the infrastructure is just not there. So that is something at community level that we need to focus on. And how do we revive health services in communities, especially family planning and reproductive health. And so we have actually proposed a resilience approach where communities are better able to anticipate, mitigate, manage, and recover from the effects of the pandemic, and hopefully also grow to be in a better place. And through this, we want to actually look at reducing exposure to the virus, reducing vulnerability by making sure that there's understanding and more certainty in the face of the pandemic. And lastly, to kind of improve the options for coping mechanisms, especially through economic opportunity, expanding local opportunities, either around existing livelihood interventions or looking at new initiatives. So I think this is in a nutshell of where we are. And we are encouraging collaboration around these three areas. We are encouraging partners to join this initiative. Dharma Life will focus mostly on the livelihoods aspect through the social entrepreneurs. Pathfinder has a priority around health, especially family planning and reproductive health. And then we're also looking at organizations and community assets that can help with the contingency planning, in reducing uncertainty. So thank you so much.
Thank you, Daniel. Yeah, I think as you mentioned, it's been exciting to see the various community examples of resilience, and which have come up, and we'll be hearing some of them today. And also, while as you mentioned, the health systems generally were under a lot of pressure, there's a lot of great examples on how technology was used specifically to at least help overcome the situation. So we'll be hearing some of that later from our VICs, from our UR corps, or entrepreneurs who work on family planning on the ground, or young couples. So let me then introduce our second speaker, Urvashi Prasad from Niti Aayog, she's Senior Policy Specialist. So Urvashi, thank you very much for participating and providing also the government's perspective. We were privileged enough to have Dr. Muni Raju here also in one of our first panels. So it's great to have Niti Aayog participate and also share the government's perspective and also highlight, as Daniel mentioned, the great work Niti Aayog has been doing with, for example, the New Normal campaign. So Urvashi, over to you.
Yeah, thank you so much. And first of all, I'd really like to compliment you on the format of this whole discussion. I've been part of a lot of discussions in the last several months, all the webinars and everything moving digitally. But this is truly unusual because we get to hear directly and engage directly with the voices from the ground, which I think are the most important. And I've worked in this sector for several years, and I maintain, even though now I'm in the policy space and perhaps a little further away from the ground, but I always maintain that the most effective and responsive policies can only be made when we are constantly hearing from voices from the ground. So this is really, I would say, a really, really wonderful format. And I think, I'll sort of take it forward from what the earlier speakers touched upon, that we have been in a very, very unusual situation worldwide. And of course, in India as well. In India, I think our challenges get compounded by the sheer scale. We have states here like Uttar Pradesh, which I always say, with over 200 million people, these are countries by themselves. It's sort of really doesn't do justice when we call them states, because they are huge, and also the diversity in terms of the socio-cultural diversity, the geographical diversity. So we anyway, even under normal circumstances, grapple with all these massive challenges. And the health system itself is, of course, very unevenly sort of developed. There are certain parts of the country which can cope much better with the crisis situation, whereas there are certain other parts of the country which get really very, very stressed in something like this. So I think we have a very difficult context here in India, but we have tried, as far as the government is concerned, the central government, of course, has had a role of putting out the sort of broad guidelines to how do you keep up the delivery of essential health services during these times. But really the implementation then happens at the state government and the sub-state levels, and that's where we as the center, we've tried to facilitate partnerships. You mentioned some of the work Niti Aayog has tried to do in bringing together civil society partners, the private sector, because I think these partnerships will be needed in the long run. This is not a short-term problem, unfortunately. So we will need to continue to work on these partnerships if we are to scale up the delivery of these services in our kind of very, very varied context. So I think that is one part that we have focused on. Also, we are trying to collate and disseminate whatever good practices have emerged. Even though there's so many challenges, in the face of that, many states, many districts have come up with some very interesting innovations. In Ahmedabad, for instance, they came up with the mobile vans called the Dhanvantri Raths, which actually deliver essential health services to the doorsteps of people so that you don't have crowding at health facilities in these times. We've had innovative use of technology, and I know some of the other speakers will speak more to this, to basically help aggregate where the demand for health services is and to match it with whatever government is providing or civil society and private sector. So we've seen these innovations, and of course we are doing our bit to try and disseminate these, scale these up, and also continue to work on these. But I think it's definitely going to be a long haul for us, because one part of the disruptions we have seen are the more short-term, immediate disruptions. So of course, during the lockdown period, perhaps these were most heightened. But they will also continue sometime into the future, given that the focus is still very much, as far as the health system is concerned, on managing this pandemic. Even in the current situation, a lot of our frontline health workers are involved with contact tracing for COVID, for instance, or they're involved in trying to ensure that the behavior change doesn't slip up. Because there is obviously a lot of COVID fatigue setting in different parts of the country. So given this, we are probably going to see some longer term disruptions as well. And these are serious, these are worrying, because if somebody doesn't get the right nutrition today, that'll probably show on their health, impact their health later on. If somebody is not screened for breast cancer or cervical cancer today, again, the consequences of that would perhaps be felt later. Immunizations which have been missed, again, we have to do a lot of catch up there. So I think, of course, it's a short-term, immediate-term issue. We do need to try and provide what people need today, but we'll need to continue monitoring this into the future as well, so that we can actually catch up with whatever has been missed or lost out. So I think that's, from the government's perspective, we realize that obviously there have been gaps on several fronts. And in a situation like this, it would only be natural to expect those. But we're trying to sort of bridge those through the partnerships, through putting in place some standard protocols. Of course, as I said, the ultimate implementation has to be at the ground level, at the district level. Sitting in Delhi, we cannot really dictate, what happens in all of India, because it just wouldn't make sense. So while we put in those broad protocols and guidelines, and we focus on partnerships, the ultimate implementation will very much be at our district and even sub-district levels. And that's where I think, the voices of people who've been working at those local levels become so critical, because they're the ones who can really tell us, what's working and where we need course corrections. So I think, that's where I'll stop. And I'm really happy to be here. And I look forward to this interaction and to this engagement, and especially to hearing from our rural entrepreneurs. Thank you.
Thank you, Urvashi. So yeah, as I completely agree, I think it's going to be a long haul, I think, for us to continue interventions, I think, across all levels. So it's now my privilege to introduce our first village level entrepreneur, Dharma Life entrepreneur, Asya Gawandi. She's from Kolhapur, and she's also not only an entrepreneur, she's also a deputy sarpanch, a deputy village head, part of the sarpanch kind of group, or the leadership group council of her village itself. She has grown into this position over the last couple of years. I think she started as an entrepreneur, and she will be talking a bit about her journey and how her community responded to the situation. So Asya, can I request you to give a bit of background on yourself and as well on the situation during this pandemic?
नमस्ते, मेरा नाम आसिया गवंडी, मैं कोल्हापुर के एक छोटे से गांव मौजे अगर की रहने वाली हूँ। धर्मा लाइफ से मैं 2016 से जुड़ी हूँ। धर्मा लाइफ के साथ मैंने इंटरनेट साथी पर और भी बहुत सारे प्रोजेक्ट्स पे काम किया। धर्मा लाइफ ने एक ऐसा प्लेटफॉर्म मुझे बना के दिया कि लोगों में मेरी पहचान बहुत अच्छे से बढ़ गई। इंटरनेट के थ्रू लोगों के जो कुछ भी प्रॉब्लम्स थे वो सॉल्व करने के लिए मैं पहले काम कर रही थी। लोगों ने मुझे पहचाना कि आप ये काम कर रही हो, अच्छे से कर रही हो, तो फिर मेरा इलेक्शन के लोगों ने मुझे सपोर्ट किया कि आप इलेक्शन के लिए खड़ी हो सकती। तो फिर मैंने चुनाव लड़ा और मैं 2018 में जीत कर आई। तो बहुत खुशी होती है कि आज मैं एक गांव में इलेक्शन जीत चुकी हूँ और अब उस गांव में मैं डिप्टी सरपंच हूँ। तो ये मेरा सफर बहुत अच्छे से रहा। कोविड के दौरान हम लोगों ने जैसे कि रूरल एरिया में इतनी मतलब सावधानियां नहीं बरती जाती, बट हम लोगों ने बहुत अच्छे से हमारे गांव में काम किया था। जैसे ही कोविड ने एंट्री की, समझ में आ गया, तो पहले हमने हमारे गांव की जो आने वाले रास्ते हैं वो पूरे हमने सील कर दिए। लोगों को विदाउट उनकी पहचान या उनका टेम्परेचर चेक किए बगैर या ऑक्सीमीटर से उनकी ऑक्सीजन चेक किए बगैर हमने गांव में एंट्री नहीं दी। तो बहुत सारी चीजें वहां पे ही हमारी कवर हो रही थी कि हम लोगों को बाहर नहीं छोड़ रहे थे, आने वाले लोगों की एंट्री थी। तो क्विक हमने सरपंच और हमारी जो बॉडी है, हमने एक अच्छे से मतलब मीटिंग ली और हम लोगों ने डिसीजन लिया कि गांव के लोगों को हम बताएं कि कोरोना कैसे फैल रहा है और हमें कौन कौन सी सावधानी लेनी है। तो पहले तो हमने गांव में गाड़ी के थ्रू अनाउंसमेंट करा दिया पूरे गांव में घूम के कि हम लोगों को ये सावधानियां बरतनी है और हमने गांव को सील कर दिया है, तो आप लोग कहीं बाहर नहीं जाएं। जो कुछ भी प्रॉब्लम हो आप हमसे डायरेक्टली आके मिले या हमें कॉल करके बताएं, और नंबर भी हम लोगों ने उन लोग को दिया था। पॉम्पलेट छपवाए, पूरे घर घर हमने पॉम्पलेट्स बांटे कि आपको क्या क्या सावधानियां बरतनी है। उसके साथ साथ हमने गांव में ग्राम पंचायत के फंड से मास्क और सैनिटाइजर भी लोगों तक पहुंचाया। फिर मतलब जैसे कि देखा कि गांव में और क्या क्या जरूरत है, हम उन लोगों को क्या क्या दे सकते हैं या कर सकते हैं। तो जैसे कि राशन था, राशन लेने के लिए लोग बाहर जा रहे थे, तो हमने गांव में एक दो दुकानदार के नंबर लोगों को सेंड कर दिया और बता दिया कि आपको जो कुछ भी चाहिए आप बता दीजिए, हम लोग आपको होम डिलीवरी देंगे। तो हमने राशन, दूध पूरा घर तक पहुंचाने का काम किया। उसके साथ साथ हमें जो गांव में किसान हैं, वो लोग, उन लोगों का भी नुकसान हो रहा था कि कहीं उनकी सब्जी कहीं बाहर नहीं जा रही थी, तो हमने गांव के ही किसान की सब्जी घर तक पहुंचाने का काम भी किया। तो लोगों को पूरा सेफ हो रहा था कि कहीं बाहर नहीं जाना है, सब्जी वगैरह भी हम लोग को सब घर में मिल रही है। तो जो सरकारी राशन था वो भी लोगों को मिल रहा था, बट जो मजदूर थे बाहर के गांव से आके हमारे यहाँ पे काम कर रहे थे, उन लोगों को अनाज के लिए या खाने के लिए दिक्कत हो रही थी। तो हम गांव के हम जो लोग हैं, जो मतलब ग्राम पंचायत की हमारी कमेटी है या हमारे सरपंच है, हमारे सदस्य बॉडी है, सबने मिलकर डिसाइड किया कि हम लोग कंट्रीब्यूशन निकालेंगे और जो लोगों को मतलब पैसे नहीं है उनको हम लोग धान्य, उनके रोजमर्रा के जिंदगी में लगने वाली जो चीजें हैं हम उन लोगों को प्रोवाइड करें। तो हम लोग ने किट बनाए, उन लोगों की भी मदद की। तो सब लोग खुश थे कि कुछ अलग कर रहे हैं और अच्छे से कर रहे हैं। वैसे ही हमारे गांव में 2 कोविड सेंटर थे, तो पूरे तालुका से लोग हमारे यहाँ पे स्वैब टेस्टिंग के लिए आ रहे थे, लेकिन हमने बहुत सावधानी से लोगों को समझाया कि उस एरिया में नहीं जाना है या कुछ किन चीजों का प्रोटेक्शन हमें लेना है, तो लोगों को बताना, जागृति हम लोगों ने बहुत अच्छे से की। तो हमारे यहाँ पेशेंट मिले ही नहीं, और कुछ जो मिले तो जैसे ही मिलते हैं तो हम लोग ने वहां पे सैनिटाइज किया, उस एरिया को सील किया और उन लोगों को क्या करना चाहिए क्या नहीं करना चाहिए जल्दी से इंस्ट्रक्शन दिए। और उसके साथ हमने गांव में जैसे कि लोगों में ये था कि हम लोग टेस्ट करने जाएंगे या किसी में सिम्टम्स दिख रहे हैं या बाहर गांव से आया है सिम्टम्स दिख रहे हैं, तो वो लोगों को लग रहा था कि हम अगर टेस्टिंग कराएंगे तो पॉजिटिव निकलेंगे। तो हमने वो दूर करने के लिए पूरे गांव में पूरे हर एक घर में जाके लोगों का मतलब टेम्परेचर भी चेक किया और ऑक्सीमीटर से उनका ऑक्सीजन भी चेक किया। तो मतलब कहाँ अगर पेशेंट अगर लगता है किसी का ऑक्सीजन वगैरह कम लगता है तो क्या क्या मतलब उसे चीजें करनी चाहिए नहीं करनी चाहिए वो भी हम लोगों ने समझा के दिया। तो ओवरऑल सब लोग मतलब सेफ थे, अच्छे से हम लोगों ने काम किया। उसके साथ देखा कि अभी गांव में काम रोजगार कुछ कम है, मतलब अभी तो नहीं है, तो हम लोगों को क्या करना चाहिए, जो गरीब लोग हैं उनको जॉब भी देना है। तो हमने कुछ नरेगा के माध्यम से लोगों को काम देने के लिए 1-2 टेंडर मतलब पास किए हैं। लोगों को हमें काम भी देना है और कुछ लोगों के हमने जॉब कार्ड भी निकाल दिए हैं। तो लोग ये कह रहे हैं कि हाँ, आप सब लोगों ने मिलके बहुत अच्छे, हमें तालुका में इस चीज की मतलब चर्चा हो रही है कि आपने बहुत अच्छे से काम किया है।
So Asyaji, thank you for this, and yeah, it's amazing to see what initiatives you took on the ground, and I mean as a from the community itself, and your panchayat or your village administration. Now, I have just one question before we move to our next panelist. I mean, what I would like to understand is, how did you come up with these? I mean, where did you find that information? How did you come up with these initiatives? I mean, and what was your previous experience? I think I understand that I think for everyone to clarify here, she had mentioned a program called Internet Sati. Internet Sati is a program which we have executed together with Tata Trust and Google to train village women to use a smartphone. And given the obviously very kind of low penetration of smartphones amongst women in village areas, if I could. And I think she's one of the Internet Satis, as she mentioned. So maybe, Asya, if you could talk a bit about,
Yeah. Gaurav, just one more note, please. Yeah. There's a question from Rag Agarwal, which is, what platform does Dharma Life provide to Asya? maybe talk a bit as context for the audience as well, so that Asya can respond accordingly, please.
Sure. So yeah, we provide a platform where we train them in various skills amongst, communication skills, digital literacy, among other things. And we also establish the entrepreneurs like Asya at the village level to be a kind of change makers. Now she has graduated into a deputy sarpanch, but this is kind of the journey she went through to reach here. But Asya, if I can ask you to answer this question around, how you found out about this information.
जैसे कि मैं धर्मा लाइफ के प्रोजेक्ट इंटरनेट साथी पे काम कर रही थी, तो मुझे पता चल रहा था कि हम लोग कैसे इंटरनेट से जानकारी ले सकती हैं, या किस चीज से मतलब कैसे हम लोगों को पता चले कि हम लोग क्या कर सकते हैं। तो मैंने बहुत सारे लोगों को भी डिजिटल लिटरेसी सिखाई है, तो मुझे पता था कि क्या करना चाहिए। जैसे ही कोविड आया तो मैंने देखा कि हमें भी अपने गांव में कुछ मतलब एंट्री होने से पहले ही हम लोगों को क्या प्रोटेक्शन लेना है या किस तरीके से काम करना है। तो मैंने जल्दी से नेट से देखा कि क्या करना है, क्या नहीं करना है, क्या-क्या प्रोटेक्शन लेने हैं, गाँव में किन चीज़ों को बताना चाहिए। और जैसे कि हमने व्हाट्सएप के थ्रू लोगों को समझाया, ब्रॉडकास्ट ग्रुप निकाला, उसके थ्रू हमने लोगों को बता दिया कि क्या-क्या करना है, क्या नहीं करना है। और उसके बाद जो संग्राम अगर के नाम से हमने एक ग्रुप निकाला था, उसमें लोगों के साथ हम मिल के काम कर रहे थे। जैसे कि उनको एंटरटेन भी कर रहे थे कि उन लोगों की क्या प्रॉब्लम्स हैं, तो वो भी हमसे शेयर करें। हमें मतलब नई-नई एक्टिविटीज़ क्या कर रहे हैं, वो भी हम लोगों ने उनको बताया। तो हम लोग बार-बार लोगों के टच में थे कि हमें कैसे करना है, क्या है। तो जिन-जिन लोगों की जो प्रॉब्लम्स थी, उन्होंने हमें बताई और हमने उस पे काम किया। तो धर्मा लाइफ ने जब इंटरनेट साथी में उसके पहले तो मुझे कुछ पता नहीं था कि इंटरनेट से कैसे क्या करना है, कुछ नहीं। बट इंटरनेट साथी से जैसे ही मैं जुड़ी, तो मुझे समझ में आ गया कि कैसे हम लोग डिजिटल इंटरनेट से बहुत सारी चीज़ें सीख सकते हैं और उस पर सॉल्यूशन भी निकाल सकते हैं। तो उस तरीके से मैंने वो चीज़ अपनाई और अपने गाँव में जल्दी से उस चीज़ों की एक्टिविटी।
Great. Thank you, Asaji. That was great. So may I now introduce our first Yuva Corp. As I mentioned before, Yuva Corps are our group of couple entrepreneurs who work on family planning as part of the Yuva program, which we are working on together with Pathfinder International, and which is supported by the Gates Foundation. So if I could introduce Mangesh and Suvarna Mane from Satara district in Maharashtra, and to talk about themselves. Suvarnaji and Mangeshji, if you could talk about yourself and also your experience in the pandemic in regards to family planning services.
नमस्कार, मेरा नाम सुवर्णा, मेरा गांव रहमतपुर, जिला सातारा, महाराष्ट्र से हूँ। और मैंने पोस्ट ग्रेजुएशन किया है, उसके बाद मैंने टीचिंग का भी काम किया है और मैंने बचत गट में भी काम किया है। और मेरे घर में 6 लोग हैं, मेरे सास ससुर, मेरे 2 बेटे और हम दोनों। ऐसा हमारा खुशहाल परिवार है।
नमस्कार, मेरा नाम मंगेश माने और मेरा ग्रेजुएशन हुआ है और मैं स्कूल में प्यून का काम करता हूँ और हमारी शादी को 10 साल हो गए।
एक दिन हमारे घर राजश्री मैम आई, उसने हमें युवा प्रोजेक्ट के बारे में जानकारी दी। जानकारी देने के बाद हम दोनों ने तय किया कि ये युवा प्रोजेक्ट हम करेंगे। तब मुझे लगा कि हमने शादी के बाद जो पहला बेटा रखा था, वो पहला बेटा हमने 2 साल बाद रखा। तब और जो दूसरे बेटे के लिए हमने अंतर रखा, वो 5 साल तक अंतर रखा। तब मुझे लगा क्यों ना हम खुद ही सफल कपल है, तो क्यों ना हम समाज के लिए अच्छा काम करूं। तो समाज के लिए अच्छा काम करना था हम दोनों को भी, इसलिए हमने धर्मा लाइफ पाथफाइंडर ज्वाइन किया। उसके बाद धर्मा लाइफ पाथफाइंडर ने हमें कंज्यूमर मैपिंग का 2 दिन का ट्रेनिंग दिया। ट्रेनिंग होने के बाद हमने लगभग 2 मंथ अच्छी तरह से काम किया। उसके बाद 1 मंथ के लिए काम ठप हो गया, लेकिन हमने लगभग 200 या 150 बेनिफिशरीज के फॉर्म हाउस टू हाउस जाकर भरे।
उसके बाद कोविड आ गई। कोविड आने से पहले इंडिया में सबसे ज्यादा महाराष्ट्र में बहुत इसका प्रभाव था, और कोविड में सब हॉस्पिटल प्राइवेट सब बंद थे और सिर्फ गवर्नमेंट का ही हॉस्पिटल चालू था। और कोविड में मुझे भी हुआ था कोविड, अब मैं अच्छा हूँ।
और तब धर्मालाइफ पाथफाइंडर ने हमें टेली काउंसलिंग और कोविड का भी ट्रेनिंग दिया। कोविड का ट्रेनिंग देने के बाद हमने टेली काउंसलिंग चालू कर दिया। तब हमारा काम चालू ही था, और हमने जो काम चालू किया टेली काउंसलिंग करते करते हमने 60 टेली काउंसलिंग करे, और उसके बाद हमें बहुत सारा अच्छा रिस्पांस आ रहा था बेनिफिशरीज का। उसके बाद हमें एक बेनिफिशरीज का भी कॉल आ गया।
फिर कॉल तो बहुत आ रहे थे। उसमें से एक नया कपल का कॉल आया। उनको जानकारी चाहिए थी फैमिली प्लानिंग के बारे में, पर उन्हें मालूम नहीं था किससे ले। तभी हम दोनों वहां गए और उनसे बातचीत की। तभी उन्हें पता चला ये इसमें भी साधन होते हैं, जैसे कि कोंडोम के बारे में उनको पता चला। वो आप फैमिली प्लानिंग कर रहे हैं, और उस ऐसे बहुत सारे कपल्स है जो इन साधनों का उपयोग कर रहे हैं।
और मेरे पास ऐसा भी एक लाभार्थी है जिसका मिसकैरेज हुआ है। उसके जो घर वाले हैं उसको बच्चे के लिए फोर्स कर रहे थे। तब वो जो लाभार्थी था उसने हमें कॉल किया, हमसे पूछा। तब मैंने और मेरे पति ने, हम दोनों ने भी उससे घर वालों से साथ बातचीत की, क्योंकि जल्दी प्रेगनेंसी रखने के लिए उसके हेल्थ के लिए अच्छा नहीं था। तब उसके घर वालों को हमने समझाया, मेरे पति ने उसके हस्बैंड को समझाया। उसके बाद वो 6 या 8 मंथ तक रुकने के लिए तैयार हो गए, और वो बहुत खुश हो गए क्योंकि उन्हें जानकारी देने के लिए कोई भी नहीं था। तब हमने उनको जानकारी दी, क्योंकि उसके हेल्थ के लिए अच्छा नहीं है, उसको क्या फायदे होते हैं और क्या नुकसान होता है, इसके बारे में पूरी जानकारी दी। तब वो बच्चे को रुकने के लिए ठहर गए, और उसके बाद उसने साधन का उपयोग चालू किया। और हमें बहुत गर्व है कि हम एक अच्छा युवाकार है, और धर्मा लाइफ का हम धन्यवाद कहते हैं।
Great. Thank you, Mangesh-ji. Thank you, Suvarna-ji. I think here, the key link here is, and we'll talk a bit more about this in our discussion, is on how, during COVID, there was a digitization of the whole effort, which we, together with Pathfinder, kind of instituted so that services wouldn't stop. But I think we'll talk about this in the discussion, but it's also a good kind of bridge towards our next panelist, Subhashini Chandran from Zinteo. She's EVP and MD of Zinteo India. And Subhashini will talk a bit about, I think, around the technology side specifically. So I think it's a great segue on, actually, we will explore this also with the second UA call. But Subhashini, over to you. Thank you again for being part of this. And yeah, we are also privileged to have Zinteo as part of our V4Village Alliance. So,
okay. Thank you so much, Gaurav. I think the idea of fostering inclusive communities of practice is so timely and enormously relevant. So may I just say how delighted I am to be a part of today's conversation and to support progressing action around this thinking. So thank you for having me. And it's an even bigger privilege, I think, to follow Asiya, Suvarna, and Mangesh's comments. And their lived experience of just being empowered by technology has set us up well for my remarks. So thank you for also the way you've sort of designed this morning, this afternoon. So some quick context settings. Zinteo's work in healthcare over the past 3 years has been focused on accelerating indigenous technologies, serving sort of last mile customers. I think the mission, if you will, has been to bring and leverage technology to enable early diagnosis and more cost-effective interventions at the last mile. So working to improve success chances for these technologies, particularly commercialization and market access, so more solutions can reach the underserved. That's been our day job before we knew that there was sort of going to be a pandemic, right? So we had about 24 technologies from innovators across the country in the pipeline and created 2 platforms, MedTech Connect and Project Page, to anchor this work. As we were already sort of working with technologies, innovation enablers, and innovators, when we realized we were amidst a pandemic, we were able to quickly transform this innovation network to an action skunk works, sort of pivoting solutions in the pipeline to respond to COVID-19 related needs. So I'll sort of give you a few examples to sort of bring that to life in terms of what we've been able to see technology do in the context of 2020. So the pandemic really has presented an opportunity for us to accelerate through screening, testing, and monitoring. So the question was sent to me around prevention, right? So one of the things that we learned about prevention really is preemption and reducing risks of community transmission is probably the best way to go is prevention. So we've worked in multiple partnership settings. A lot's been said already by Urvashi and Daniel about collaboration. And so I would reiterate that point. Our lived experience is that partnerships have helped and really been key. So both with government, but also broader private sector action around education and awareness, for example. So one of the things that many people did around us in the world of business, and so we did too, was mainstreaming messaging around prevention into other work we were doing in education awareness, be it waste management modules for children, and incorporating hand washing, social distancing, all of that. So there again, a huge play by technology where we had digital access to get messages out. Then, of course, a lot's been done around mass distribution, and we've certainly been able to support that effort, safeguarding materials, etc. But I think one of the cool things I want to talk about in this meeting is the ability to create proactive screening solutions to detect early and thus avoid risk of transmission. We were able to use a technology that we had, leveraging sort of tested telemedicine solutions like the eDoctor platform of Karma Health, layering this with mobile applications and a clinical algorithm from someone else, a technology called Bryota. So I know there might be some students on this call who might be interested to look up some of this. And they were really focused on lung care originally. So to bring these sort of technologists and innovators together and very quickly produce COVID-related early screening solutions in the community. So this was a great example of virtual evaluation where we could deploy local teams. We didn't have to rely on healthcare workers, and leverage technology to reduce the dependency on healthcare professionals and empower communities to unlock what really in your language is groups of practice to tackle and respond to this need. So we were able to get local community efforts at doorsteps to gather information, then to use AI to be able to analyze that and feed back to government in the context of the Municipal Corporation of Mumbai, for example, or in very remote mining communities in Jharkhand and Chhattisgarh through private sector channels. So I think sort of my point here is such approaches can easily be extended for capacity building at the last mile and also unlocking capacity of workers aligned to healthcare, such as government and local journalists and villagers, etc., citizen journalists and people like that. So for you, Gaurav, I think Dharma, this is all sort of very known language and thinking because so much of your work leverages these approaches. But the strategy of combining technology and community as delivery agents can truly, I think, unlock resource pools and reduce demand pressures on healthcare professionals and additional risks posed with externals entering in the context of the pandemic, COVID-19 affected communities. What we've also been able to do then is to see standardization, right, of these solutions so we can deploy them in a range of settings. Shifting the lens to another question that was sort of sent across to me to say, what about non-pandemic related healthcare services and needs? And just some very powerful examples we've just heard around how we reach family planning and reproductive health and communications and awareness and solutions around that, even in this current context, by delivering alternative channels, right? Like so the Yuva Corps and social entrepreneurs. So other examples on the back of that, I think, is something many of you might have heard of from PATH, using India Post for delivery of contraceptives at doorsteps, or using immunization value chains for dispersing contraceptives. A similar, very powerful collaborative approach more recently, towards the end of the year, has been Project Step 1 for large-scale screening and teleconsultations through 7,000 plus volunteer doctors across the country. And the data there is they've managed to reach about 23% of COVID-19 positive patients in the country. So pretty massive, again, leveraging technology. So I think, yeah, the big point really is like technology's role in disrupting access favorably to democratize healthcare, but also enable early diagnosis and reduce emergencies is now known and sort of in a sense undisputed. In COVID-19, I think many technologies that we've worked with have been able to pivot to support testing, screening, and rehab, so just rehabilitate their purpose very, very smartly. We're also seeing like some of our other portfolio solutions, another one called Cardiac Design Labs, that have come up with complete remote patient monitoring in hospital settings without using sort of healthcare professionals. Again, so low resource settings application there. Healthcare goods and services, I think more and more in 2021, what we'll see is delivery through non-health distribution channels using simple technology solutions. And there again, I think I would urge much more Dharma Life sort of solutions out in the market where their networks are there, footfall is already there. How can we use them to do more and more around non-COVID related healthcare is, I think, maybe a question I would leave for some of the experts, both on the panel and other guests in this forum. Wrapping up my comments, I think what we have seen is technology can and must play a huge role in healthcare access. So many of us already know this, crisis or otherwise. But 2020 has been a year of transformation and watershed. We've been working on so many technologies for years now, but really it's been a watershed moment for Indian health tech. We've seen several powerful examples of solutions pivoting to respond to new and unanticipated needs. So speed, agility, again, to underline the point on deep collaboration for reach at scale, I think are key. And a combination of community-based ambassadors. So we'd really love to see Dharma Life sort of solutions just go countrywide and unlock foot soldiers, especially for awareness and education, to deploy easy-to-use tech with minimal training, right? So we can really respond to this shortage around healthcare professionals and much more joint efforts between business, the private sector, government, civil society, and more importantly, also across domains. So it's not just healthcare portfolio working on its own, but healthcare with other businesses like FMCG and others. If we can encourage that, I think we can reach many more services and goods related to healthcare, particularly in the context of the short term of 2021 and 2022 to tide us over and reduce the longer term impacts that Urvashi was sort of alluding to. So with that, I think I'll stop there for now. Thank you, Gaurav.
Thank you, Rupashni. So I have now the privilege to introduce our last panelist, a couple, Yuva couple from Bihar. So it's Satinder ji and Anjali ji from Nalanda in Bihar. So could I request you to also give a quick introduction of yourself? And I think particularly interesting, I think some examples mentioned on technology. There was a question around the telecounseling piece. So I think that will come up in this example where I think we have examples of moving the in-person counseling at the village level to digital formats through WhatsApp. And I think, yeah, we'll see that example. So I hope that was what was meant. There's no counseling line. It's an in-person local level solution. So over to Satinder ji and Anjali ji. Yeah, Satinder ji, Anjali ji, can you please unmute yourself? Yeah, and then thank you.
नमस्ते, मेरा नाम अंजलि कुमारी है। मैं नालंदा जिला बिहार की निवासी हूँ और मेरी एजुकेशन बीए कंप्लीट हो चुकी है। मैं ब्यूटिशियन के कोर्स के साथ मैं सिलाई का भी काम करती हूँ और सिलाई सिखाती भी हूँ। मेरी शादी को 18-19 साल हो चुकी है और मेरे परिवार में 5 सदस्य हैं, जिसमें मैं, मेरे पति और मेरे 3 बच्चे हैं।
नमस्कार, मेरा नाम सत्येंद्र कुमार, मेरी शिक्षा 10वीं पास है और मैं सिलाई का काम करता हूँ।
जब मैं एसएचजी में भी मीटिंग अटेंड करती हूँ। जब मैं एसएचजी के मीटिंग में गई हुई थी तो मेरी मुलाकात शैलेंद्र सर से हुआ है, जिन्होंने मुझे धर्मा लाइफ और पाथ फाइंडर के बारे में बताया, जो ये बोले कि जो ये एक युवा कार्यक्रम चलाती है जिसमें परिवार नियोजन के बारे में परिवार नियोजन पर काम हो रहा है। तो हमने सर से पूछा, सर ये क्या है, कैसे होगा, मतलब इसमें और क्या करना पड़ेगा। तो सर ने हमें सारी बात बताई। फिर हमको ये बात सुनकर अच्छा लगा, हमको लगा कि ये काम बहुत अच्छा है। फिर हमने अपने पति से पूछा तो मेरे पति भी इस काम को करने के लिए इच्छुक हो गए। सबसे बड़ी रीजन ये था कि जो गलती हमने किया है, परिवार नियोजन के बारे में जानकारी ना होने के कारण हमने ये गलती किया कि जो हमको इसके बारे में जानकारी नहीं था। तो हम सोचे कि जो गलती हमने किया है हमारी आने वाली पीढ़ी ना करे, नव विवाहित जोड़े वो गलतियां ना करे जो हमने की है।
इसी सोच के साथ हम लोगों ने इसका ट्रेनिंग लिया और
6 दिन का
6 दिन का ट्रेनिंग लिए, और फिर जब फील्ड में उतरे तो पता चला कि हमारे गांव की महिलाएं और पुरुष इस बारे में बात करने से कितना डरते हैं और शर्माते हैं, और कोई जानते भी हैं तो ये खुलकर बात नहीं करते हैं हम लोगों से कि नहीं ये अच्छा चीज नहीं है। ये हम लोगों के लिए एक चैलेंज था।
हम लोगों को जैसे लगा कि जैसे हम लोग को कोई बताने वाला नहीं है तो हमने ये गलती की, तो क्यों ना हम ये काम को करें। और फिर इसके बाद से हम इस में जुड़ गए, और जुड़ने के बाद हम लोगों ने पहले तो कंज्यूमर मैपिंग किया। कंज्यूमर मैप वैसी महिलाओं के पास, मतलब जैसे महिला जो थी गांव की महिला, चाहे जो भी महिला कहें, परिवार नियोजन के बारे में खुलकर तो बात करना नहीं चाहती थी, और इस बात के लिए उनको जानकारी नहीं था। अगर कोई करना भी चाहती थी तो हिचकिचाती थी। तो इसके लिए हम लोग को सबसे पहले तो कंज्यूमर मैपिंग करना पड़ा। उस घरों के पास को चिन्हित किए जिनके यहाँ नव विवाहित दंपति था या जिसका एक बच्चा था, वैसे परिवार से हम लोग कंज्यूमर मैपिंग किए। फिर उसके बाद से उनका काउंसलिंग किए,
काउंसलिंग किए, और इस चीजों के बारे में हम लोग खुद बात करने लगे। धीरे धीरे हमारे गांव के लोग हैं जो हम लोग को समझे कि नहीं ये हमारे हित के लिए बात कर रहे हैं तो इन्हें सुनना चाहिए, और सुनने लगे, और हम लोग उन लोग को परिवार नियोजित का सही तरीका बताने लगे और उनसे बात करने की, अगर आप नई शादीशुदा, आपका उम्र कम है तो जैसे 18 है तो आप 2 साल वेट कीजिए पहले फर्स्ट बच्चे के लिए। इसके साधनों के बारे में बताएं, आप किस तरह इसे रोक सकते हैं, नियोजित कर सकते हैं। मेन रूप
इसी के बीच कोविड-19 आ गया। फिर हमें लगा कि काम हम लोग का बंद हो जाएगा, लेकिन हमारे धर्मा लाइफ के सर लोग थे जो इसको भी हम लोग को काम करने में आसान कर दिए।
तो हम लोग को
डिजिटल मैपिंग के बारे में
बताएं, जिससे सर्वे कंज्यूमर मैपिंग किए और फिर टेली काउंसलिंग भी किए।
और इसमें हमको ये हुआ कि जैसे जिस महिला के घर में हम लोग जा नहीं पा रहे थे, तो उन लोगों को तो फोन के जरिए हम लोग उनको बताए, फिर उनको प्रोडक्ट के बारे में बताए, फिर प्रोडक्ट में उनको डिमांड हुआ, तो फिर डिमांड का जो प्रोडक्ट को हम डिमांड करती थी उस प्रोडक्ट को हम सेफ्टी के साथ ग्लव्स लगा के, मास्क लगा के, सैनिटाइजर के साथ में उनको पहुंचाएं, और इससे वो लोग बहुत खुश भी हुई।
इसके लिए हम लोग को सबसे ज्यादा डिमांड आया पुरुष कंडोम और महिला गर्भ निरोधक गोली। इन दोनों का डिमांड हम लोग के पास आए, तो कोरोना काल में भी हम लोग पूरे सेफ्टी के साथ उनको प्रोवाइड किए।
फिर उसके बाद से महिलाओं से हम लोग का बोलचाल बातचीत अच्छा होने लगा। फिर फोन भी आता है, फिर हम लोग उनसे बात भी करते हैं, और ये सारा काम धर्मा लाइफ और पाथ फाइंडर के से हुआ है कि हम लोग की एक पहचान बन गई है। हम लोग खुल के बात करते हैं, कहीं भी जाते हैं तो हाँ ये दीदी आए हैं, ये भैया है, ये चीज के बारे में बताते हैं, इनसे उस चीज का सुझाव लेना चाहिए। ये हम लोगों को अच्छा लगा। और क्या बोले, और तो बस
थैंक्स धर्मा लाइफ एंड पाथ फाइंडर।
धन्यवाद।
Good. I thank you very much, Anshi ji, as well. I think we are now moving to our discussion. So I would encourage the audience to ask any questions. I think we've already answered some of them on the chat, and I would now hand over to Rajesh to moderate and take us through the next part of our roundtable.
Perfect. Thank you, Gaurav. Gaurav, actually, the first question from the audience, and let me reemphasize to those on this conversation to fire away any questions you have. Otherwise, you'll hear me talking. Gaurav, there's a question for you about the Dharma Life entrepreneurs and their remuneration. Can you talk a bit about how the livelihoods aspect of Dharma Life works for the entrepreneurs?
So I think, yeah, sure. So we, the entrepreneurs, the UA Corps, or as well as the Dharma Life entrepreneurs, earn income per completed session. So either by person reached, by person counseled. So it's an outcome focused payment model. And obviously it provides a livelihood for them, but it's important that we kind of incentivize outcomes as well as kind of the initial mapping exercises. So this is largely done on an outcome basis, and also the entrepreneurs earn from the sales of the products. So that's the income streams which we have. And I think the design between Pathfinder and us for the family planning program was the idea is that you first induce someone into the cause and the program. They have to first map their target audience, and that normally does not happen in a program. It's usually done before by others, but here the idea is that the entrepreneurs do it themselves, and they're incentivized for that, so that later on they can counsel from your own.
Wonderful. Thank you, Gaurav. So I have a question for the panel broadly, as we and then we'll take more questions. Each of you, directly or indirectly, mentioned the importance of the folks on the ground, those who are actually making change happen. So converting ideas that government officials or NGOs or other entities might have to those making change on the ground happen. Now, during this event, during this COVID pandemic, in responding to this, we were fortunate to have a group of 15, 16,000 Dharma Life entrepreneurs who had already been creating change on the ground. Can you speak to, based on your experience, either in this specific context or more broadly, about the value of creating capabilities, whether helping bring out the inherent capabilities of individuals psychologically, helping with technological capabilities, that are creating capabilities that are general, that could then be applied to various activities. So in this case, for instance, we saw, Asya and the capabilities she had that came out because of her work with internet activities, and now that is paying off in the COVID era in the collaborations. Any comments or capabilities or comments or reflections on the topic about building individual capabilities that are general in order to develop healthcare solutions?
Yeah, thank you so much, Professor Chandy, for that question. I'll quickly respond to that. So there are three areas that are very important, especially with regard to access, especially with regard to whatever goods and services and capabilities that are there. So the first is ensuring availability. How do people know about what's available, what goods and services are available, what capabilities are available, what facilities are available. So that's the whole aspect that is quite important, because the community should know, as rights holders and as citizens, what is available to them. The second whole area is access. How do they access these services, and how do they use these services, and how do they benefit from them? So there are so many barriers to access. There are physical barriers, there are financial barriers, economic barriers, there are knowledge barriers, social barriers. So I think that's the second big area, that we want to look at. And the third big area is what is the use, of this? So how are they being used, and what is the impact it's having? So by investing in community capabilities, especially people like Anjali and Asya ji, and we are ensuring that there are enablers, to access these the intentions basically of services and policy and all of that. So they are able to explain to their communities, what's available for them, what are their rights, and what benefits they can bring. Secondly, they also can help dismantle some of the barriers, take away some of the myths, especially we saw during. So even though we invest in general capabilities, these come in very useful when there is distress, and when there is so the function is basically a very strong and relevant safety net, for at a community level. So that is my quick response to that. I hope it makes sense.
Thank you, Daniel. Let me take a few questions and direct them. There are some questions from the audience. So Shibani Bose asks, I suppose, Gaurav, you're best positioned to answer this. How are the entrepreneurs selected and recruited? Clearly today we've met some great entrepreneurs. And the success of all of this, the availability, access, use, etc., all of that comes from finding the right entrepreneurs and supporting them. How do you go about doing that, Gaurav? Just selection and recruitment.
Sure, I'll just do that quickly. So we would go to the village level and kind of identify at the village level from backgrounds which are underprivileged. So we would identify women who don't have a livelihood, are first-time entrepreneurs. We would cross-reference them with village influencers or key opinion leaders, like the sarpanch, like the head of the village, or village head, or the influential kind of health worker, asha worker, or health worker, or the Anganwadi worker, so the preschool worker. So we actually do a cross-reference. Then after that, we run an interview, and then they're appointed for their own village. So important facts here are the idea is to uplift them, right? Secondly, obviously there's certain criteria on their skill sets, most of which we train. So we train them on. And the third thing is that they are from their own village community, because the idea is to have someone who's trusted already. And so that's where it is. I think there was another question around how we work with the government. So the intent here is to supplement government efforts. And I think there was a comment on, do we compete? That is not the intention. The clear idea is that local level, there's partnerships with the ASHA worker or with the health worker. And the intent is really to augment and supplement and support the government efforts.
And actually, I have a question about that, both for Urvashi, on how Urvashi, you had mentioned the importance of collaborations. Now, how does that actually happen? And also some voices of the village, of those who had collaborated, how did they go? What is their perspective on the relationship between the ASHA workers? By the way, there is a glossary we had included for those of you who are not familiar with an ASHA worker, who's a healthcare worker at the village level, or other such terms. There's a glossary at the start of the chat for this. But back to the question, Urushiji, how does that collaboration work with other entities? And then we'll also get some voices from the village, please.
Yeah, I think it's we do say collaboration a lot, but it is tough to make some of these work. There is no doubt on that. But I think, ultimately it comes down to doing it at a very decentralized level, So while we, as I said, sitting here in Delhi, as NITI Aayog or as Government of India, we obviously facilitate a lot of these partnerships. So we also work on a program which some of you might be familiar. It's called the Aspirational Districts Program, which are some of the most we don't like to call them backward, we call them aspirational, but these are basically districts which have a lot of catching up to do on various indicators. And so, we do have these sort of direct links with states and districts. So what we do sitting here is that anytime we see good work, being done by a civil society partner or by private sector, we do try to make those connections with the states, with the districts. So we sort of play a demand-supply matching role. And in fact, that's the kind of role we would like to work more on and strengthen, because I think there is a huge opportunity for that. But ultimately, the partnership itself has to work at the local level, because that's where the context comes in, that's where all the dynamics come in. But the center can certainly, and does in several cases, support, either by making those connections or providing the funding or whatever that case might be. But yes, I think there are several challenges in making these sort of multi-stakeholder collaborations obviously work on the ground, because people come from different perspectives and they have different views on how things should happen. But I think COVID has shown us some very successful examples of how that has happened on the ground. And I think we need to learn from those, and we need to institutionalize those lessons, to your point, that can we learn from, these certain generic things which we can use in the future as well. So I think that's what we really need to do going forward from here.
Thank you. In fact, if I could, and I realize we're almost out of time, but before we go, final few words, if I could ask Anjali ji and Satyendra ji, Anjali ji, you mentioned you worked as a beautician, and Satyendra ji, you were a tailor, and now you're providing advice to community members about health-related topics. You must have interacted with the ASHA, the healthcare worker in the government related healthcare worker in the village. How do they see your role relative to theirs? Do they see, the question from the audience was, do they see you as competing with them, or how do they see your relationship with them? What has been your experience?
अंजलि जी।
जी 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 जी
जी सर।
हाँ, बात कीजिए।
Take some time on the translation.
जी उनको यही
The suspense builds.
नो हाँ, आई थिंक अंजलि जी आपको सवाल समझ में आ गया?
जी जी
जी सर आ गया।
हाँ,
जी
तो आप जवाब दीजिए।
आंगनवाड़ी में जब हम लोग जाते हैं, आशा और एनएम दीदी से मिलते हैं, तो उन लोग हम लोग को फ्रेंड जैसा उन लोग को लगता है, क्योंकि हम लोग उन लोग के काम में कभी बाधित नहीं बनते हैं। उन लोगों को ये बताते, उनका भी काम यही है कि उनको भी बताना है दीदी लोगों की परिवार नियोजन क्या है, और हम लोगों को भी ये काम है, तो हम दोनों मिल के काम करते हैं। उन लोगों को कभी ये नहीं लगता है कि ये हमारे काम को बाधित कर रही है या कंपटीशन में है कि हम बेहतर करें या हम बेहतर करें, ऐसा कुछ भी नहीं होता है। हम दोनों मतलब वो और हम लोग सब एक साथ मिलकर टीकाकरण में भी बैठते हैं, वहां भी सबको बताते हैं। और आशा दीदी अगर बोलती हैं कि घूमने चलना है, तो उन लोग के साथ में भी घूम लेते हैं, तो उनको लगता है कि ये हमको हेल्प कर रही हैं। कभी ये नहीं लगता है कि कंपटीशन है, कि वो बेहतर कर रही हैं या वो अपने नाम के लिए करेंगी तो हमको गलत होगा, मेरा ड्यूटी में कुछ खलल होगा, ऐसा कुछ नहीं होता है।
सहयोग ही करते हैं जहाँ तक।
टीकाकरण में भी बुला लेती हैं, फिर आंगनवाड़ी की दीदी आशा दीदी घूमती हैं दवाई वाई देने के लिए गांव में, तो उन लोग के साथ में भी अगर बोल दी या मिल गई तो हम भी कहते चलो हम आपके साथ में घूम लेते हैं, आपको भी हेल्प मिल जाएगा, तो ये हो जाता है। उनका भी काम हो जाता है, मेरा भी काम हो जाता है, और कभी वो ये नहीं समझती है कि ये कंपटीशन में हम दोनों खड़े हैं।
And how do they see their goals as separate from your goals, or are they the same?
जी
हम दोनों के कार्य रोल समझिए एक ही जैसा है। मतलब उनका सिर्फ ये इतना है कि वो डिलीवरी के लिए हॉस्पिटल लेके जाती हैं और हम उनके साथ में गांव में घूमते हैं लेकिन काम दोनों का वही है। वो भी परिवार नियोजन के बारे में बताती हैं, हम भी बताते हैं। अगर उनको भी जैसे कि फर्स्ट टाइम पेरेंट्स कोई हुआ, उनको गांव में पता नहीं चला है नया नया, तो हम उनको बता देते हैं कि ये फर्स्ट टाइम पेरेंट्स है या पहली बार माता पिता बन रहा है, तो उनका भी रजिस्ट्रेशन करवा लीजिए। ये सब बताते हैं तो उनको भी अच्छा लगता है।
और उनको है कि सभी को करना है, और हम लोग को सिर्फ युवा विवाहित जोड़ों को ही करना है जिसका उम्र 18 से 24 तक का ही है। तो ऐसे में हम लोग को कोई दिक्कत नहीं है, ना ही उनको दिक्कत है। वो जहाँ तक हम लोग को सपोर्ट ही कर देती है कि वहाँ भी नई नई शादी हुई है या आए हुए हैं तो आप चल सकते हैं हमारे साथ, हमें जाना है।
हम भी उनको बता देते हैं, वो भी हमको बता देती है। जैसे उनको कोई नहीं पता है, जैसे हम किसी नए शादीशुदा के घर गए, उनको वो जैसे अभी 1-2-3 महीने की हैं या अभी आई हैं, उनसे खुल के वो बात नहीं कर पा रही है, तो हम लोग को तो रिलेशन बन गया, हम उन लोग से खुल के बात कर लेते हैं। लेकिन उन लोग से थोड़ा हिचकिचाती है, तो हम लोग जब साथ में जाते हैं तो उनको लगता है कि नहीं दीदी साथ में है तो चलो ठीक है, इसलिए उनको हिचकिचाहट नहीं होता और हम लोग को एक दूसरे के साथ काम करने में भी तकलीफ नहीं है, कोई दिक्कत भी नहीं होती है।
This is a wonderful example of those collaborations, those complementarities we've been discussing throughout, and thank you all for making those come alive. I'm going to hand things over to Benethia to wrap up, but before I do so, let me just say thank you to each of you for helping create the capabilities that Daniel was referring to helping create those capabilities that are general and that are very individual in the lives of individuals, but then they come in as precious and invaluable, and especially in crises like these, but more generally as well, in ways that we can never expect. And thank you for helping create the linkages that we so badly need, and is often so hard to sort of envision, but we saw some wonderful examples of these. And thank you for helping create these wonderfully serendipitous accidental outcomes that we saw so many examples. So I'll hand things over to Benethia to wrap up, and I know we're out of time.
Thanks, Rajesh. I'm going to kind of make an attempt to try and pick out a couple of key insights or learnings that I got out of this, and there were so many interesting things that were spoken about that it was actually quite difficult for me to pick a few. I think for me, the most interesting bit was we started with a very idealistic sort of model of how global realities undergo customization with rural context and then community action, which in theory is a very beautiful approach to behavior change, to communication, to driving progress. And what is amazing is that this theoretical approach was brought alive with multiple examples across many, many different sort of spheres of health through some of the stories that we heard from Asya, from Anjali, from Satyendra, from Suvarna and Mangesh. Daniel spoke of how collaboration was extremely, extremely important to deep dive and understand the various aspects of health that go beyond COVID-19. And it is these entrepreneurs, these sort of what I would even go to say that are heroes on the ground who get us this information and allow us to make strategic decisions, create communication, leverage technology. As Urvashi mentioned, it is these innovations and these amazing things that are happening at a village and a district level. It becomes our job as stakeholders to take those innovations and take them to other districts, to other villages, to other states. We're a complex nation. Urvashi mentioned that every state is like a country in itself in many ways. So it's amazing how different stakeholders have come together, played their strengths, and allowed us to create a beautiful, cohesive system, of course, backed by technology, as Subhashini spoke about, repurposing existing technology, this amazing combination of technology and a human network coming together to deliver real, impactful change. And I've actually almost sort of mentioned everyone except for our heroes on the ground, because I think it's their stories that genuinely stole the show. It is amazing how pre-COVID, they've built up their respect, their identity, had that sense of agency, which was, like Rajesh was saying, then turned into something that worked towards the benefit of community without anyone having to tell them what to do. They leveraged the information and the resources they got through all of the other stakeholders, understood the ground reality, and put it together. And again, we saw through the examples that we spoke about of the Yuva program, a program that was conceptualized pre-COVID, had amazing intent. There was sensitization, there was counseling, there were products being delivered, had a huge roadblock with COVID. Of course, focus had completely shifted to directions away from family planning. Yet, while making sure that they took care of their communities through COVID and their precautions, these heroes, these entrepreneurs, these Yuva core made sure that they did what they had to continue promoting the very, very necessary program of family health. I'm going to pause here for a moment and hand over to Daniel, who wants to just very quickly talk to you guys about some very, very interesting collaterals that they've put together that we will be sending out to you guys. So I'm just going to pause very quickly and then sort of conclude the session.
Thank you, Benethia. I'm not going to take up very much time. So I mentioned that we had conversations with communities. So we had conversations in Gaya and Nalanda in Bihar Unfortunately, lockdown prevented us from having, but I think they visited more than 40 villages and spoke to community leaders, spoke to households, and they put together a delightful little fictitious story on consolidating all the conversations called At the Crossroads. And we are going to post a link in the comments box, so anybody who wants to access it can access, but we will also post it on social media to look at how communities are functioning in the face of COVID-19. So thank you, Vanetia. That's the announcement I wanted to make.
Thanks, Daniel. That brings us to the end. And I think one of the most important aspects of Voice to the Village, of this collaborative sort of action, these communities of practice that we're taking, is that just as important as our stakeholders who are speaking are, it is you who tune in every time, who ask us the interesting questions, the tough questions. It is you guys who actually make this event really, really powerful. And so I want to take this opportunity to reach out to you and ask you, what is it that you'd like to hear more about? Are there particular topics that you'd like to hear? Is there something that you'd like to tell us about the format that you'd like us to do differently? If you have something that comes to mind, please enter it in the chat. If you don't have something that you've got fully formed yet, don't worry. We will be sending out a simple survey where we can take your suggestions. And believe you me, it is these suggestions that are going to, for sure, make this event richer and develop as we go along. Next slide, please. It is ultimately when all of us across different sort of areas of practice, across different areas of expertise, at different levels in the entire chain, come together, right, and work together in what is can only be described as a true sort of form of collaboration. Can we really drive that inclusive progress? You can see that we've got the email ID there, dharmalifelabs@dharmalifefoundation.org. Write into us. We'd love to hear your ideas. If you want to kind of join in, be part of some of the work that we do, we'd love to hear from you. And before we go, I'd just like to make one call out to a whole bunch of partners who've come together in this time of need early on in this year when COVID hit. They've come together and, led by Dharma Life, created the V for Village Alliance, which is essentially an alliance that is looking at an immediate response to the COVID-19 pandemic, but more importantly, looking at aiding the recovery and building long-term resilience in these communities to really drive inclusive progress. So a big shout out to each and every one of these partners. This alliance is something that has made significant progress in terms of trying to understand and respond, right? And then over time, there are multiple initiatives. You heard about Jaya the last time, which is an initiative which is focusing on increasing women's workforce participation. You will hear more about technology and some of the other stuff that we're doing as part of this alliance, of course, spearheaded by Dharma Life, by DLLABS, and by all of these partners coming together. So once again, thank you very, very much for all the panelists and all of you who've tuned in today. As always, we will be coming back with more interesting topics across different areas, but always, always focused on how we can get different stakeholders from rural, from urban, global stakeholders to come together to address the most pressing issues to drive true inclusive progress.